So hi everyone, welcome to the channel with this new video. Many of you are asking about the exam pattern in Georgian medical universities, particularly those who took admission in this year. Well, exams depend on the subjects you have. So that's why I divided this video into two parts. In the first part of this video, we will talk about the exam patterns for the non-clinical subjects. And then the second part of this video, we will talk about the exams for the clinical subjects. In the non-clinical subjects, you have anatomy, physiology, biochemistry, and you have pathology, pharmacology, and so on. So before we go further, we need to understand one thing, that we have the two midterms and one final exams for the non-clinical subjects. And we have the one midterm, one hospital rotation, and the OSCE exam, which is final exam for the clinical subjects. Now let's talk about the preclinical subjects. So in the preclinical subjects, we have two midterms. Each midterm will be for the 30 marks and one final exam will be for the 40 marks. If we talk about the level of questions, there will be multiple choice questions, and the level of question will be not that much easy, not that much tough. Yes, when I was in my first year, they used to give us the single liners question, which is short questions. But nowadays they are changing the pattern, and they are also giving us the clinical scenarios. Nowadays in the NEET PG, in the FMGs, they are also giving us the clinical scenarios. So that will be the same pattern. I think this is the advantage for us, because at the end of this 5 year, we have to give the competitive exam, we have to give the screening exam in India, and this will be also the clinical scenarios, there will be also the MCQs. So in these 5 years, we are practicing a lot of questions, so that in the final exam, we don't feel that these are the new things for us, right? So this is really good for the practice for the final exam. So now let's talk about the clinical subjects. So in the clinical subjects, we have one midterm, and this midterm will be for the 30 marks, and we have the 15 hospital rotation. Each rotation will be of the 2 marks, and that's why there will be the 30 for the rotation and 30 for the midterm. So these will be the 60 marks, and rest of the 40 marks will be all OSCE exam in the final. So basically, you have to give one midterm, you have to do the 15 classes, each class will 2 marks, you have to give the 15 classes for the rotation. So basically, in the hospital rotation, you have to see the patient, you have to analyze the patient, doctor will show you the reports of the patient, like x-ray reports, lab findings, and also the ABG analysis, and so on. And you have to just think about the hypothesis, and maybe the doctor will ask you some questions regarding the patient, so you have to answer that particular questions, and then they will give you the marks. So each will be for the 2 marks, so this is the 30 marks, rotation will be the 15. Obviously it will depend on the subjects, right, which subject you are doing. Now the question is, what we do in the final OSCE exam. OSCE is basically a clinical scenario based exam. They will give you a clinical scenario, and it can be a long case or the short case, and there will be the 4 or 5 or maybe the 6 question regarding to the case, and you have to analyze the case first of all. Like basically, you have to play a role of general physician here. The professor will be the patient, right? And you have to, first of all, they will ask you, like they will notice your communication skills also. So you have to analyze the case, you have to think about the diagnosis, about the radiological finding, what investigation will you do to reach the diagnosis, and also they will ask you about the differential diagnosis, about the prognosis, or of course there will be the treatment option as well. So you have to think clinically. So when you will go to the hospital, you will see that there will be the clinical things, like you will learn a lot of clinical things. In my previous video, you can also check on my channel, I uploaded a ICU rotation, my ICU rotation also, you can check it out. So yes, that was all about the exam pattern in Georgia. I don't think other universities has any difference in the exam pattern. Like I think all the universities in Georgia will be the same exam pattern, and yes, there will be OSCE, midterms, and all the things, and practically you have to go to the hospital in the clinical subjects if you have. So that was all about the video. Thank you so much for watching this video. I hope this video will help you. See you in the next video.